Up to 30 million American men are affected by ED, according to the National Institute of Diabetes and Digestive and Kidney Diseases. The prevalence of ED increases with age. ED affects only 4% of men in their 50s, but nearly 17% of men in their 60s. Furthermore, almost half of all men over the age of 75 will suffer from ED. Although the risk of ED increases with age, ED is not an inevitable consequence of getting older. It may be more difficult to get an erection as you age, but that does not necessarily mean you will develop ED. In general, the healthier a man is, the better his sexual function. The potential causes of ED are numerous. They include cardiovascular disease, diabetes, damage from cancer or surgery, injuries, stress, anxiety, relationship problems, drug use, alcohol use, smoking. These factors can work singly or in combination. What are the symptoms of erectile dysfunction? ED is defined by an inability to get or sustain an erection firm enough for sexual intercourse. It has no other symptoms. What is the outlook for erectile dysfunction? ED is a treatable condition. There are a number of ED treatments available. The type of treatment generally depends on the underlying cause of ED. Treatments for ED range from counseling and lifestyle changes to drugs and surgery. If you suffer from ED, it is important to talk to your doctor. A doctor can help identify the cause of ED and figure out the most appropriate treatment. Because it can be embarrassing to discuss ED, many men look for treatment options online. However, not all treatments are safe for all men. In addition, many of the treatments available on the internet are scams. They may not help ED and could damage your health. It's important to check with your doctor because ED may be a sign of additional health problems. For example, if you have heart disease, you can take a number of steps that will likely improve both your heart health and your ED. These might include lowering your bad cholesterol, reducing your weight, and improving your diet. But if the doctor is quick to recommend medication, that is also a concern, as you may want to consider safe, natural options first. Standard treatments for ED include lifestyle changes such as exercising, losing weight, stopping smoking, curbing alcohol intake. Medications like Viagra, Cialis, or Levitra increase blood flow to the penis. But they can also cause side effects, including nasal congestion, headache, upset stomach, vision changes, facial flushing, dizziness. Men who have experienced a stroke or have uncontrolled diabetes or low blood pressure should not take ED medications. Common treatments for ED, non-drug options. Non-drug treatments for ED include penile vacuum pumps, penile implants, and blood vessel surgery. However, we can't recommend these things as they do nothing for the root cause of the problem. Risks include those typically associated with surgery, such as infections. Blood vessel surgery is recommended only when leaking vessels cause ED. Even though all these treatments may help some men, natural alternatives can be just as effective but less invasive. Natural solution number 1 and number 2, Panax Ginseng and Rhodiola Rosea. Called a herbal Viagra, Panax Ginseng, red ginseng, has solid research behind it. Researchers reviewed 7 studies of red ginseng and ED in 2008. Dosage ranges is from 600 to 1,000 milligrams 3 times daily. They concluded there was suggestive evidence for the effectiveness of red ginseng in the treatment of erectile dysfunction. Natural solution number 3, DHEA. DHEA is a natural hormone produced by the adrenal glands. It can be converted to both estrogen and testosterone in the body. Scientists make the dietary supplement from wild yam and soy. The influential Massachusetts male aging studies show that men with ED were more likely to have low levels of DHEA. 40 men with ED participated in another study published in 1999, in which half received 50 milligrams of DHEA and half received a placebo once a day for 6 months. Those receiving the DHEA were more likely to achieve and maintain an erection. Natural solution number 4, L-Arginine and L-Citrulline. L-Arginine is an amino acid naturally present in the body. It helps make nitric oxide. Nitric oxide relaxes blood vessels to facilitate a successful erection. Researchers studied the effects of L-Arginine on ED in 1999. 31% of men with ED taking 5 grams of L-Arginine a day experienced significant improvements in sexual function. L-Arginine is important for optimum health and is thought to protect against a number of health conditions. An increase in blood flow or circulation in the body can help benefit every organ, as oxygen is the number 1 molecule needed for cellular metabolism and healing. Increased blood circulation improves oxygen-rich blood flow to extremities, and so L-Arginine can be effective against a host of problems. Natural solution number 5, acupuncture. Though studies are mixed, many show positive results when acupuncture is used to treat ED. A 1999 study, for example, found that acupuncture improved the quality of erections and restored sexual activity in 39% of participants. A later study published in 2003 reported that 21% of ED patients who received acupuncture had improved erections. Other studies have shown conflicting results, but this treatment has potential and may work for you, especially if combined with the previously mentioned treatments. Other potential natural treatments. Other alternative therapies thought to help ED may include zinc supplements, especially for men who are low in zinc, the herb ashwagandha, also called Indian ginseng, and ginkgo, but more studies are needed to know with certainty. Another groundbreaking therapy involves the use of high-frequency sound waves to awaken and regenerate cells of the penis. The pulsating waves stimulate release of growth factors which lead to the development of new blood vessels. For more on this, look for a future video or download the free PDF below. In the meantime, talk with your doctor about your options and don't give up. ED is a common condition that's very treatable. With some trial and error, you're likely to find what works for you and your partner.